So we'll go ahead and get started. Thanks. I'm Sarah Ring. I'm in charge of internships and employer relations for Northwestern in career development. And I've got a presentation I'm going to talk through with you. So we'll kind of switch over to that now. And if you're not seeing this at any point, let me know if I'm talking about something that you can't see. You should see an internship slide. You want to give me a thumbs up or a yes if you got that. Give you a reaction. Okay. All right. So if you at any point you want to interrupt and just ask a question, feel free to jump in. That's absolutely fine. Otherwise, I'm just going to kind of plow through on the presentation. But again, feel free to jump in if you want to. Okay. So internships, basically for your group. And we've just had a event a few months ago about, what do you want to be in your future? We had a couple for healthcare people stop by. So just in general, what I'm going to cover this evening is why would you want to do an internship? Why are they important? I know they're not necessarily required in biology. You can do research projects and other things, but we really think they're valuable and important. We're going to share some advice from professionals, most of them alumni, I went out and said like, hey, I'm doing a presentation on internships. Do you have anything you'd like to share with the group? And I had probably 8 or 9 people get back. And so we kind of selected some of their advice to share. And then just what would you do next? So what are next steps from here? So first off, we're just in a webinar this week about kind of recruiting trends from employers for the next coming year, for those who are graduating this spring. Basically, what they're finding is that people are hiring through COVID, and there's been a big flux, in not hiring for a while. Some industries are growing. There certainly are expanding opportunities in health services. So that's a growing field, and there are a lot of jobs available right now. So that's great news for you. What the statistics are showing is sometimes in an economic downturn, you'll see people say, well, I want to go get my master's degree, so then I'll have more education and be more employable. But employers right now are saying, we really want people who have more work experience rather than just another degree without work experience. So we're really saying it's important to get that work experience in addition to getting your degree. So they told us that in the scientific area, biology, physical, therapy, that sort of thing, clinical, hiring is going to be up 20% from this year compared to last year. So there's a big, big jump. They also talked about the fact that there's 40% of doctors who are practicing now are going to reach retirement in the next 10 years. So there's a big need for medical professionals to come into the workplace. And there's this Fauci effect that they're talking about now because healthcare workers have been so much in the forefront on the news and, what we've seen from Dr. Fauci and all of his work. Medical school apps are up 18% this year. So there's going to be more people applying, but we need more people to apply because there's going to be a lot who are going to be leaving for retirement over the next 10 years. Just let someone in. Okay. So moving on from there, why would you want to do an internship? Well, it's one of the options that you can have in order to complete your biology or health sciences degree. But when employers are looking at, I've got 2 candidates that look on paper to be roughly the same. The way they decide is basically the 2 questions they ask. They do an internship at my organization, at my hospital, at my medical firm, and did they do an internship somewhere in my industry? So if you do one of those 2 things, you're much more likely to get the job than somebody who maybe has a higher grade point average. They really want to see internships, and relevant work experience. So it's going to help you get ready for your graduate programs. It's going to help you get ready for your career. I just can't state enough how important it is to get internships and how valuable they're going to be for you. And finding the right one is something that's worth investing some time and some effort in. So we're going to talk about how do we do that. Let me just go back for a second. You probably saw the picture there. Caitlin, she was selected as one of 5. This is not this past summer, but the summer before, one of 25 interns at the Mayo Clinic. So it was a great honor. She had a great experience. And again, it's an awesome way to make contacts in the field and to get really hands-on experience. So what's the best way to get an internship? Really, ideally, you want to get to know people. You want to reach out into the field. It's who you know. It makes a difference. The average job posting, if you just apply online for a college graduate level, there's over 250 applicants who go after one position. So you're in a lot of competition if you're just throwing it out in, well, here's an online job I found, I'll just apply for it. You could go to your current employer if you're in a healthcare related position now and just say, could I make this an internship? Could I do some extra research? Could I maybe do a project? Maybe there's something that they've been wanting to get to and they haven't had time, and it would be a great, project for you to work on. You can volunteer at a hospital and ask, the same sort of thing. Could I volunteer and do some sort of work that could be counted as an internship? So you'll want to talk to the employer, you'll want to talk to your advising professor, and then, see if you can put together something that would fit both areas, get you experience, meet the academic requirements, and also help the organization. So it can be a win-win-win all the way around. In terms of full-time jobs, 70 to 80% of them are found because of networking. So we just keep telling students, I know it's hard, and I'm an introvert, it's hard for me to go out and meet people and network, but that's really how we get jobs. That's how we find connections. It may not be the shortest and fastest route, but it's going to get you in the door at a much better rate. This last statistic, employers hire 40% of their new hires through their employee referrals. So if they know somebody and they say, oh, I had this student contact me from University of Northwestern, my alma mater, we should have them interviewed because I know they wanted to apply for this job. So, and sometimes the employees of the company will even have a link that they'll say, okay, well, you can apply through Indeed or through LinkedIn. But you know what? I've got a referral link that says this came from an internal employee and I'm referring this person. So I vouch for them. And employers love to see that when they know somebody in their company who's vouching for a graduating student to come into the organization. You're so much more likely to get a job that way. So maybe you're saying, I don't know anybody. I don't have all these contacts in the field. So what am I going to do? So we have been working for the last almost a year on something called Career Communities. And this is brand new. We haven't even launched this yet. In fact, I'm presenting it to the department chairs of the faculty tomorrow. So it'll be the first time some of them have seen it. So you're getting even to see it before them. But what we've done is we've done over 280 people in different fields. Could be from accounting to engineering to nursing to healthcare and science to ministry. And we've grouped all these different kind of professions together. And then we've gone out with a survey to say, how could you help our students? Could you offer career advice? Could you maybe do an informational interview? Could you maybe do a tour of your we can't do very tours right now, they're employers, but could you do a resume review? Just look over someone's resume. And we let them choose all the ways they would plug in. So let me just jump over to that website. So I'm going to switch my screen share. Let me know if I lose you along the way. Oh, I did lose you. Let me switch to here. Everybody with me again? You hear me okay? All right. Make sure I'm not missing anything here too. Okay, so you should be seeing the page that says Career Communities now. Everybody seeing that? Okay. All right, so here's what we're going to start, and there'll be a link to this on the Rock. In fact, there is now under our career development page. So basically, what we're saying is we've already gotten these people together who have already agreed to meet with you and connect with you and talk with you in whatever ways that they've offered to do that. It might be just, I just want to talk to somebody who's a PA, or I want to talk to somebody who's going into dental school. What advice might they give me? How could they help? So I went out to this same group, and you can choose, here's all the different communities, accounting and finance. Like I said, I chose healthcare and science. You could also, we got one for nursing. And then I just said, I'd just like some career advice. And then you can click at the bottom, it says view members, and it'll bring up all the names of the people who are in that group. So several of these offered to help. Phil Baumgarn, you might have seen him. He is the recruiter for ACR Homes, so he's been in the building a number of times. Brittany Bjornstad, in fact, that earlier slide where I showed you with the students talking with a professional, that was Brittany. She's a PA, and she came to our event we had last year. I just got an email from Leah Charles. We heard from Andrew, who's a med student at Rocky Vista University. We also heard from Lily, who's a medical student, from Jeff. So a number of these people were willing to say, hey, Sarah, I'd love to give some advice. I know, I wish I would have known this when I was starting out with my PA career or in medical, as a medical school. So this is going to be a great resource, we think, for you. So I'm going to jump back to the slideshow. Get back to there. So you'll be able to use those career communities and reach out to professionals and make contact with them. And we'll talk about how you want to do that. So when you first reach out, you're thinking, I don't know this person. They graduated from, UNW maybe 5-10 years ago. You can either reach out on LinkedIn. The career community lists, if they have a LinkedIn, they'll have their LinkedIn address, so you can just look at what their profile looks like. We'll also have an email for them, and then you can just email them and say, first of all, how do I know you? Kind of introduce yourself with a connection. I'm a student at Northwestern, you graduated from Northwestern. You want to say, here's what my circumstances. I'm going to graduate in May, or I'm a sophomore and I'm still trying to figure out what field I want to go into. Tell them what you need. I would really like to meet with you, on Zoom, or have a, phone conversation, or could you look at my resume and just tell me if that looks good? And then end with a call to action, or here's what I need you to do. Could I call you this week? Could we meet, on Zoom? Could you look at my resume if I send it to you? So that's a good way to kind of start the approach. Again, introduce yourself, what the connection is. Here's where I'm at. Here's what I'm looking for. Could I ask you to do this for me? And then you want to be able to tell your story well. I mean, you've all got a story on how you got here, why you want to be a health professional. And part of that starts with resumes. So a good resume is really built out of good skill statements. And when you have a strong resume that you've maybe written in Word, then you can take those same skill statements and just drop them into Handshake, drop them into LinkedIn. And we'll talk about that more in a minute. But a strong skill statement is like an action verb, to start with a verb, give some detail, and then if you can, what was the outcome, or what was the result, or any more specifics that you can give me about what you did there. And you probably want, for each job that you have, probably 2 to 5 skill statements underneath. So if we just said like, an okay one would be, I was a teacher's assistant for BIO 1011. Okay, well that kind of gives me your job title, but that doesn't really tell me what you did. You could say, I was a teacher's assistant. You could list that as the job title, and then you could set the skill statement and said, I help students learn biology concepts. That's better, but that's still not giving me the detail. Whereas if you said, I coached 35 or more students this semester on key biology concepts by, how did I do it? I led study sessions and created Quizlets. Well, now I know that you can work with a group of people, you can lead a group, you can lead a study group, and you reinforce those biology concepts. That tells me a lot more about you than just the fact that you were a teacher's assistant. So that's the kind of thinking we want to do, and those are the kind of skill statements we want to have. We've got a lot of online resources, again, back to our Confluence page on the Rock, or you can set an appointment with me or with Jacob Cochran, who's our other career coach, April Stensgaard. We'd love to meet with you. You can reach out to one of those career community members and have them, check somebody who's in healthcare and who agreed to do resume reviews, and have them take a look at it. So then once you get your resume in good shape, what you want to do is take those skill statements and put them into Handshake, put them into LinkedIn in your profile, and make your Handshake profile. There's a switch where it starts out private. You want to switch it to public, because what happens then is the employers out there who are looking for somebody with a biology degree, who's maybe a junior, can find you, and they'll contact you with, hey, we've got this job opening. Hey, we've got this internship. Do you want to apply for it? So they can find you without you having to do the work. So that's all really helpful. So what are some of the top employers that we work with? I've mentioned ACR Homes. They're recruiting a lot on campus. Really any kind of direct patient care right now, there's huge opportunities for them. They are hiring. ACR Homes has been our top internship employer for at least 5 years. And they basically say, come on and work as a direct care professional. And then, I mean, they've done internships for accounting, they've done internships for biology, for health sciences, for, you know, kinesiology. So they'll help you kind of create your own internship. This Cindy Welch Chelstrom, she graduated in 2019. She was the Internship Impact Award winner for 2018 for all of the interns at ACR Homes. She was working with a client and was realizing that her circulation wasn't very good. So she, did some research on it, created a new development therapy plan for her, and helped her circulation get better by the end of the time that she was working with her. So she's working on her doctor's in physical therapy now. So those internships can really have an impact on not just her clients in this case, but on your future career. I mean, that looks great on a resume to say that she was the Internship Impact Award winner. So Presbyterian Homes is another one that's common. Emergency Care Consultants, Scribe America is another scribe company. You'll hear scribing is another really good internship opportunity. And so it may not be a job that's listed as an internship. It might just be a part-time job, but that's fine too. I will say that scribes, oftentimes they'll ask for a 1-year or a 2-year commitment. So just be looking for that as you apply for those jobs. I looked at just some listings. So I looked in Handshake, in LinkedIn, and Indeed. Those are probably the 3 that we look at most frequently. So there's a number in Handshake. These are just part-time jobs. I don't know that any of them are internships specifically, but they're part-time jobs that would certainly count as an internship. Again, you would check with your professor. But those are available just locally here in the Twin Cities. On LinkedIn, Fairview had a community health intern, and Blue Cross Blue Shield had a continuous improvement intern. So either of those would probably be good opportunities. I looked over on Indeed, and there was a COVID testing team role, part-time, evening tech thing at Bluestone Physician, and then a health unit coordinator at Regents. So again, these might not be your long-term, this is my career type job, but it's a great way to get your foot in the door at Regents, at Fairview, at Blue Cross Blue Shield, at some of these care facilities. So again, you're thinking about opportunities. Where am I going to learn? Where am I going to make some contacts? How am I going to get to know an organization if I like it or not? And then then there's Ramsey County on this Friday at 10 a.m., 10 to 11, is having a healthcare virtual job fair. So again, that'd be a great opportunity to just check into that and see what they've got available. I mean, Ramsey County is a big employer, so they would have a lot of opportunities, I would guess. So I would encourage you to sign up for that, and you can, the website's there at the bottom, which is ramseycounty.us. So I'd encourage you to check that out. I've just heard about that a couple of hours ago, so I was happy to add that to the slides. Now this is our career community members, and so again, I kind of didn't include all of them because there was a lot, but here's some of the things that they suggested. Jeff Heider works over at Medtronic, who was like, start the process early, November and December for next summer. And he's not kidding. A lot of these big companies, especially like Medtronic, I mean, we find some companies are almost done hiring by October for the following summer. So you want to get in early, start thinking about it. Don't wait till the last minute. He suggests that if there's a company or an organization that you're interested in, network with people who work there. So you can kind of get your way into the organization, be professional. Ask what they're doing. What does their day look like? What's important to that organization? Because some organizations are going to have different values and different skill sets that are important compared to others. So you want to find that out ahead of time. He suggested even ask if somebody would mentor you, and that's a good way to get your foot in the door. So that was Jeff. This is Andrew Laro. He is a 4th-year med student at Rocky Vista. He had some great suggestions about communication. So when you're going out and you're talking to admissions departments and hiring departments, when you have a good internship that you can talk about and it overlaps with where you're going long-term, that's really great. But even more important, and I love that he mentioned this, you need to be able to talk about it well. So you need to have stories that you can share. What was really important to you? Why did I want to work with seniors? Why did I want to work with people with disabilities? What was challenging for me? What was hard? Why was I nervous about going in here? But that idea of talking and sharing your story is really valuable part of the internship too. So as you're working an internship, even think about, wow, this really challenged me. I think I've really grown. What have I learned in this situation? And be able to talk about that in your interviews for grad school and also at jobs. Tom Smith, he is a head athletic trainer at North Central. He says, again, internship at a place you think you'd like to work when you're done at school. So be thinking about long-term, where do I want to go? You might try the place out and think like, oh, I thought I'd really want to work in a hospital, but that's not really, I don't really love this environment. So maybe I want to go somewhere else. And internships is a great time to figure that out, play around in a few different areas and see what you like or don't like. If you can, go to somewhere they could be a reference for you for future positions. Like show up early and stay late if you can, ask lots of questions. So you don't want to be slacking off. You want to be a good worker who people are going to look positively on and want to help you into your next step in your career. This is Alicia Klein. She's also an alum, I believe, and she works with the PA program over at Bethel. So she has a lot of advice about what you need to look for. She says CNA or EMT are both easy certifications. And then you can either find volunteer opportunities or employment opportunities. She's mentioned the scribing is really good because you get exposed to a lot in the clinic, and you also get exposed to the terminology and using that terminology regularly. She has some other training, paramedic, athletic training. I mean, right now there's a lot of COVID helping opportunities that you could plug into. So she suggests any of those would be great opportunities if you're thinking about being a PA, and I know one or two mentioned that. Shadow a PA, if you can job shadow somebody. I know my daughter at one point was thinking about going into medicine. And so we just talked to our family physician and said, could she just hang out with you for a morning and follow you around and see what happens in the clinic? And that was a great experience for her. So as you can job shadow different people, and again, right now may not be a wide open opportunity, but in the future you can be thinking about that to see day to day what does that job look like. Tia Anderson is a psychiatric associate at Fairview. She says, a lot of people love interns because they don't cost much. You can kind of help mold somebody. And she says, even if an internship isn't paid, it doesn't mean it won't be better. Sometimes they'll have more hands-on skills, more direct contact with you than an unpaid internship. I can't speak to that. Generally, we find paid internships are good, but don't discount the opportunity with a volunteer or an unpaid internship. Those can also be really good experiences. This is Madeline, occupational therapist. She came to one of our networking events also. She says, even if you don't get one that you're initially excited about in an internship, keep doing it because it could lead to some amazing opportunities. So she says, you may not find the perfect fit right away, so keep trying new things. And a number of people mentioned, try new things. Don't be afraid to try something different. Don't lock yourself into, well, I thought I wanted to be this, so those are the only opportunities I want to look at. You might, want to open things up a little bit, try some different opportunities and see what you end up liking. And then this is Lily, who's a med student down at the University of Antigua. She says, do things that you're passionate about, which I think is great, something you have a personal connection with. And I love that she talks. She says, I know it's tempting to find the most prestigious thing or what would look good on paper. And she says, those are good. But in interviews, they're going to talk to you about what you did. So if you can be enthusiastic and connect to the work, that's going to come across much better than if you just did a job because you thought it would look good, but you hated it and you didn't care about it. So I think that's really important too, is think about what you're passionate about, what you're excited about, what you're going to want to connect with, because that's going to come through in an interview for a grad school or a job too. She also suggests reaching out to local hospitals, that there may be a medical resident who has to do a research project. You might be able to be a part of that, so you can check into that also. Okay, so let me kind of wrap this up. Some of the resources that are available to you. If you look on the rock, the student academics page is where you're going to find us, and here's the career development site. We've got a number of things. Internships, there's a whole page just on internships, which is right here. The process is all outlined in detail here. I won't go through it, but I'll summarize kind of what happens. Basically, you're going to go out, find an internship either through networking or on Indeed or LinkedIn. or handshake or one of those things. You're going to start, you'll apply for it, you'll interview. When you get to the interview process, run it by your academic advisor, your faculty internship advisor. So maybe Dr. Sinat or Dr. Winslow, Dr. Light, whoever is supervising that for you, and just say, hey, this is the job description. This would be okay for an internship, right? I mean, 95% of the time it is, but you just want to do that double check. Then once you get the job, you start working. And once you land the job, that's when you apply for the credit. So that's where you go to handshake and you say request an experience. And you have a lot of time. So like the March internship deadline is, for the spring internship deadline isn't until March 22nd of next year. So we let you keep looking into the semester before you have to register that credit. So you just have to do the internship request through handshake that. So like we said, we're going to shape up your resume as your next step. You can send it to me, you can send it to Jacob, make an appointment. We're happy to help. Find an internship that you want. Make sure, again, that you're turning on the handshake profile and making that public, that you fill out your LinkedIn profile, because again, employers are looking in those places to find students. Check with your faculty advisor. I just saw something today, sometimes students will be like, well, I applied for this job, so I'm going to wait and see what happens. I saw some guidelines today, apply to a minimum of 20 different roles. So don't apply for one or two and then, wait to see what happens. Keep putting them out there and keep working your network. Ask your friends, ask your family, ask your, friends from church. Just, here I'm looking for a job in this area. This is what I want to go into. Do you know a dentist maybe where I could job shadow, or could I do a project, or could I maybe do an unpaid internship with them for a couple hours every week? But be asking people to help you. You never know when somebody's going to know somebody else who has just a great opportunity for you. So then you register at a handshake, what we talked about, work the internship. You're going to build new skills, which you're then going to go back and add to your resume, add to your handshake, add to your LinkedIn. I'll send out an internship survey at the end of each semester, which is, you'll rate yourself on how you did in a number of things. Your supervisor on the site will rate you, and then that'll be turned over to your faculty advisor. And then whatever homework or research report or whatever you do for the academic. So that's kind of how the whole process of internships looks. And then just a couple more just about how to interact with career development. You can download the Handshake app, create your profile. Again, be sure to make it public because that's how employers can see you. You can make appointments with us on Handshake. You can register for events like this, which you did. And then you can look for jobs and internships. You can follow us on Instagram. We highlight every Friday. I highlight different paid internships. Generally, it's been like, here's a company that's offering a bunch of internships. Or sometimes we do just for bio majors. Here's internships for you that are in Handshake. Sometimes we'll talk about events. So if you're not following us, UNW Career Development on Instagram. We also in LinkedIn, once you create a profile there, we have our closed group that's just called the University of Northwestern Alumni and Student Group. And I will say probably 80% of the posts that I put in that group, we've got about almost 3,000 people in there now, is another alumni who's out in the field says, hey, guess what, we're hiring. And then I just repost that in the alumni group. So there's lots of jobs posting that you'll be able to see if you're part of that group. And then subscribe to our YouTube channel. We're always, we're trying to update things with webinars. This will go up on our YouTube channel so that you can see that. We also have free resources online. We've got Big Interview, which is a practice interview program. It'll give you, in fact, you can go specific, you can do a general, just give me some easy interview questions with, strengths and weaknesses, tell me about yourself, things like that. But you can also go by industry. You could say, if I want to interview for med school, if I want to interview for a research job, if I want to interview for a healthcare position, what were the kind of questions I might get there? So they can give you specific by industry questions, and you can practice and you can record yourself and you can see how the background looks and how, make sure your pajama bottoms aren't showing in the interview. So it's a good practice role. Candid Career is just a whole hundreds and hundreds of short videos, maybe 2 minutes or so, that will tell you, what does a research coordinator do? What does a personal care attendant do? What does an LPN do? And it'll just give you short videos of people describe their careers. They talk about the advantages and disadvantages. They talk about how to prepare for those careers. So if you're just, I'm not sure what kind of career, I think I want healthcare, that's a great place to search and just, run some of the short videos and see what you think. Just below that, ONET is a huge, very robust website by the Department of Labor. And it's all kinds of careers, again, hundreds and hundreds of careers. And you can do really a deep dive on, well, what is an occupational therapist? What do they do? What kind of skills do they need? What kind of education do they need? What kind of pay do they get? How many job openings are there going to be in the next 10 years? So you can really do some great research on specific jobs, and then you can find maybe related career fields that you're interested in. And then finally, the True Motivate, maybe some of you have taken this. It's basically not a personality profile, but a what drives you, what moves you forward. And it's a new assessment that we've partnered with. We were one of the first universities to have this. And it's been really helpful for people to kind of understand what kind of a work environment would I be good at, and helps you know kind of what motivates you, so then how are you going to behave in certain situations. And so that can be a really helpful assessment. So we'd encourage any of you to try that as well. So all of those are you can go to our site on the Rock, and we've got all those resources available for you. So I will just open it up. If anybody has questions, you can put them in chat, or you can just unmute yourself and share those. I'd be happy to hear what you have to say. Or we can just sit quietly.
Is there any way that this PowerPoint can get posted somewhere so that we can go back and just take a look at those sources again at a later time?
Absolutely, yes. I'll put it in the YouTube channel right afterwards. And in fact, we can probably put a link out. I can send it to Maddie, or I can, hopefully we'll get all your names on here through the recording so I can send it to you. Absolutely.
Thank you.
Sure. Well, if there's nothing else, I'll let you get to your rest of your evening. If you do have a question, feel free to email me. Again, my name is Sarah Ring in the career office. Really happy to meet with all of you. I hope this was helpful. And again, check out our resources. If you don't want to email me directly, you can just email career@unwsp.edu. We're happy to help you. So thanks for coming, everybody. And if you have any more questions, feel free to reach out. Bye.